scanning the room for my head to toe resubmission. That is my Snellen chart there. Excuse me. Hello, my name is Genevieve. Can you tell me your full name and date of birth?
Nicholas Nichols, 10/8/1989.
Awesome, nice to meet you, Nick. And can you tell me what brings you into the office today?
I'm here for my yearly exam.
Okay, we can get that done for you. So before I start this exam, we're just going to start off with some screening questions, okay? And then, so can you tell me what year it is today?
It's November 2025.
Perfect. And then are you having any pain right now?
I am not.
And then how did you get here to the office?
I drove myself.
Great, awesome. So you look like you're not in any acute distress. Looks like you're alert and orientated. You're able to participate in your ADLs. Drove yourself here today. Look like you're in general good health. So first, I'm going to start with some vital signs to start your assessment. During this assessment also, we're going to be, like I said, doing some vitals. I'll be inspecting some areas, listening to your heart, lung sounds, and then just using some light touch, okay? Is that all right?
That's okay.
Perfect. I'm gonna put this on your finger. Check your temperature here. That blood pressure kind of gets really tight the first time, so sorry about that. Perfect. All your vitals looks great. They are within normal limits. Your heart rate was 76. Blood pressure 118/72. Respiration 17, SpO2 or your oxygenation on room air was 98%. So now I'm going to be moving into my full head to toe assessment, okay? So first off, general appearance, I'm looking at your scalp and head first. Your head is symmetric, normal cephalic. I don't see any lumps or lesions. Anything that's concerning that I can see right on my first inspection. I'm going to start with some touch here. Any pain while I'm touching your scalp?
No.
Perfect. Okay. Scalp feels good. No masses noted. I'm just going to have you put your head up a little bit. And now I'm going to be palpating your temporal arteries. Any pain while I'm palpating your temporal arteries?
No.
Okay. I'm going to be going down to assess your jaw for TMJ. So just looking at this joint, this temporomandibular joint here. I just want you to chew up and down. Any pain while I'm pushing?
No.
Perfect. Okay, so no crepitus noted, no clicks noted. And then while I'm here, I'm going to assess some cranial nerves. So can you smile for me, big? Awesome. Can you puff your cheeks out? Stick your tongue out. Do like a frowny face. Perfect. Cranial nerves, those cranial nerves that I just tested are intact. And then I'm going to be assessing your lymph nodes now, just making sure that I can't palpate them, make sure they're not enlarged or anything, okay? So we're going to start with the preauricular, postauricular. Going to come down to the tonsillary. We're going to go to the submandibular, submental, go back to the occipital here. We're going to be doing the anterior cervical, posterior cervical lymph nodes, supraclavicular lymph nodes. Any pain while I was pushing any of those areas?
Nope.
No? Okay, awesome, great. So I didn't feel any large lymph nodes, so that's good. That means none of them are enlarged and nothing to worry about. So now I want you to I'm going to assess for what's called JVD, jugular vein distension. So I just kind of want you to put your neck at a 45-degree angle here. Okay, don't see anything there, don't see anything on that side. That's great. And now I'm going to be looking at your ears. So with your ears, looking on a general inspection of your outer ears, looks good. Colors within normal limits, don't see any lumps, lesions, or masses. I'm going to grab my otoscope here. Okay, So actually before I use my otoscope, I'm going to do some palpation or touching of your ears. We're going to start with the tragus on both sides. Any pain there?
Nope.
How about the pinna? Any pain while I'm touching your pinna?
Nope.
How about the lobes? How are those feeling?
Good.
Good? Okay. All right. Just going to be looking inside your auditory canal here. Okay, both your auditory canals look good. They are both pearly gray, and I can see that visible cone of light, so that's good. We're gonna do the occipital nerve test. It's testing your cranial nerve 8. It's called a whisper test. So what I want you to do right now is I want you to cover up your left ear. I'm gonna whisper some words, and I just want you to tell me what words you hear, okay?
A, B, C.
Perfect, okay, I'm gonna come on to the other side here. I want you to cover up your right ear. Now I'm gonna whisper some words to you, okay?
Apple, pear, banana.
Perfect, okay, you passed that. So cranial nerve number 8 is intact. So we're gonna finish up with your head assessment here. So I'm gonna grab my ophthalmoscope, my pen light here. So I'm going to be assessing your eyes now. So I'm going to be checking your optic nerve number 2. So I just want you to stand up, Nick, okay? And we're going to have you test, use the Snellen chart that we have here. So I want you to cover your left eye up. And then can you read the bottom line there?
A, D, F, C, M.
Perfect. Okay, and now you're going to cover up your right eye. Read that bottom line there.
A, D, F, C, M.
Perfect. Okay, now you can take a seat if you would like, just because we're going to finish up with some more exams of your eyes. So this is going to be called the red reflex test. So I'm just using this here. Look at just those red reflexes in both your eyes. Perfect. So red reflexes were bilaterally seen, so that's good on that eye exam. Now this is going to be testing your optic nerve or cranial nerves 3, 4, and 6. Just looking at your vision still. I'm going to be using my pen light here, so we're testing for what's called perla, just making sure your pupils are equal, round, and reactive. Perfect there. Okay, now one more test on your eyes. So what I want you to do is it's basically called the accommodation test. So I just kind of want you to follow my pen light here, okay? Perfect. Again, optic nerve 3, 4, and 6, all within normal limits, and then all 6 cardinal fields of vision are within normal limits. So now, excuse me, got a frog in my throat. I'm going to be assessing your mouth. So with your mouth, grab my pen light again here. General inspection on the outside of your mouth looks good. Lips look moist, don't look chapped, don't see any lumps, lesions on your mouth. And then I want you to open your mouth up here, okay? Open up big. Stick your tongue out, please. Stick your tongue out more, all the way. Okay, perfect. Just assessing your tonsils here. Tonsils +1. And then while I have your mouth open, can you actually stick your tongue out again? And then do a big swallow. And then keep your tongue out though while you're swallowing. All right, so just wanted to make sure your uvula was rising equally. So that looks good. So we're just assessing some more cranial nerves, okay? So those cranial nerves look good. All right, so now while I've got you sitting up, I'm going to be assessing another cranial nerve. So what I want you to do is just shrug your shoulders up. And then what I'm gonna do is gonna be putting my hand on your cheek here, and I just kind of want you to turn your head with full resistance, okay? Perfect, so got some good strength there, strength 5 out of 5. All right, perfect. And then last little bit of our head exam is I'm gonna be testing some sensation, and then one last optic nerve, or not optic nerve, sorry. I'm going to be testing another cranial nerve, your olfactory nerve, number 1. So just testing smell here. So we're going to start with the olfactory nerve, number 1. I just want you to close your eyes. Can you tell me what you smell?
Perfume.
Perfume, okay, perfect. You can open your eyes now. And then we also are going to do some sensation. Just testing some more cranial nerves here. So I'm going to have you close your eyes, and then I just want you to tell me if you feel like light touch, or if you feel just like sharp or kind of pointy or prickly touch, okay?
Light touch. Light touch. Pointy touch. Pointy touch. Pointy touch.
Okay, perfect. So you can open your eyes now. And then what I'm gonna have you do is actually, if you don't mind, I'm gonna have you take off your shirt, because I'm gonna work down from your neck to your abdomen and your lungs and all that good stuff, okay? Perfect. So I'm gonna do some more palpation here. I'm just assessing your thyroid gland, making sure it's not enlarged. Can you swallow for me? Perfect. Any pain while I'm pushing?
Nope.
Awesome. Okay. And then now, I want you to kind of take a seat down again, or just lay down if you don't mind. Now I'm going to be doing your abdomen and looking at your abdomen. So on the inspection of your abdomen, first I'm just looking at your aorta, just making sure you're not having like any bounds, heaves, or lifts. Looks good. Abdomen looks flat. I don't see any visible masses, no lumps, no lesions, no adventitious scars or anything that is concerning out of the ordinary. So first, I'm gonna, like I said, finish this abdominal assessment by doing some listening or auscultation. We're gonna start in the right lower quadrant, just listening for some vowel sounds. All right. Normal active vowel sounds are noted. And then I'm gonna be doing what's called percussion right now. So I'm just looking for tympani, and I also want to assess for dullness at your liver, okay? So just gonna be doing some tapping here. Okay, resonance and tympani noted, so that's good. And then I'm gonna be doing some palpation now. It's gonna start with light palpation, so that's just light touch, and then I'm gonna be doing deep palpation. Purpose of this is I'm gonna be testing to make sure you don't have any organomegaly, like in your kidneys, just making sure I can feel your liver, just make sure it's not feeling enlarged and all that stuff, okay? So starting with light touch now. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Okay. No organomegaly noted on light touch. Deep touch now. Any pain?
Nope.
Feeling the liver. Feels good. Any pain here?
Nope.
Don't feel your spleen. That's good. Any pain right there?
Nope.
Okay. Perfect. Okay. So that abdominal assessment was good. So now we're going to be doing some other just general assessments. I'm going to be doing some more cardiac assessment while I'm here. And then afterwards I'll have you sit up and we'll do your lungs, okay? So right now I'm just going to assess some pulses. Just making sure I don't hear what's any bruits or thrills on your aortic artery. Look, sounds very good. Testing your renal artery over here. That sounds good. Renal artery over here sounds good. Iliac artery sounds good over here. Iliac artery sounds good over here. Just move your hand for one moment. I'm going to be testing your femoral arteries, so is it okay if I kind of pull down?
Mm-hmm.
Okay, perfect. Sounds good there. Sounds good there too. Okay, Nick. So now I'm going to be finishing your cardiac assessment. So first, while you're laying down, I'm just going to be listening to your cardiac sounds, okay? Cardiac heart sounds, I should say. So I'm going to start listening at your fifth intercostal, listening your apical pulse for a full minute here. Just listening for S1, S2. No murmurs noted that I hear. No thrills. No bruise. Perfect. Okay. And then I'm also going to do the 5 cardiac markers. Again, just listening for the same S1, S2 normal heart sounds as we call them. So starting at your aortic. I hear good lub-dub, S1, S2, pulmonic, and after the pulmonic, I went down to the tricuspid, and then I went to Erb's point, tricuspid, and then I've got your mitral valve here that I'm listening to. All right, S1, S2 noted. I didn't hear any murmurs, any gallops, any adventitious heart sounds, so that's great. And again, just looking for JVD or jugular vein distension while you're laying down. Don't see anything there. Gonna also listen to your carotid pulses while I'm here too. No bruise noted on that side. No bruise noted on that side too, so that is good. All right, now I just want you to slowly sit up, and then I'm gonna assess your lungs. So first I'm gonna do a anterior or front side of your lungs assessment. So we're gonna test your lung sounds in the 6 cardinal fields of your lung assessment here. So just breathe normally for me, okay? lungs sound good. General inspection of the chest and appearance of your chest does look good too. You don't have any barrel chest. That would be like concerning of a condition called COPD. So that's good. I also am noting that your respiration rate is even, symmetric. I'm gonna do also what's called some palpation of your lungs too, just making sure I'm not feeling any crepitus. Let's take a deep breath here. So crepitus, it would just kind of feel like, almost like popcorn in your chest. Don't feel anything there, or anything noted on your anterior chest or respiratory assessment. Now I'm going to be doing some percussion, just testing like tactile fremitus. Looking for resonance and just kind of no vibration and stuff. Okay, so that is good. Now I'm going to be doing the back of your chest, just listening to your lung sounds back here. So thank you for scooting up to the end of the exam table. Assessing your spine right now and assessing your back. Everything looks good. Skin is, within normal limits. No lumps, lesions noted that I can see. Start with your lung sounds. So I just want you to take a deep breath in. 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 Listen to the bases of your lungs. Take another deep breath. Another deep breath. Okay, all your lung sounds sound clear. No breezes, no rails, just vesicular lung sounds noted. So everything is within normal limits on your lungs. Now I'm just going to check for what's called bronchophony. So I'm going to be listening to different areas in your back, and I just want you to say 99.
99. 99. 99. 99. 99. 99.
Perfect. Okay, so no bronchophony present.
I'm still checking.
Sorry, I just got a phone call. I just want to make sure it didn't stop. Okay. Okay. So now I'm going to be doing what's called just some CVA tenderness, checking your kidneys here, okay? So tell me if you have any tenderness here. Feeling any pain?
Nope.
Okay, perfect. I'm glad you're not feeling any pain. That means your kidneys should not be enlarged. Nothing to worry about there too. And now we're just doing some light percussion too of your lung fields back here, okay? So just looking for some resonance and all that stuff too, okay? Perfect. All right. All that is normal. So now we have done your respiratory assessment. So now I'm just gonna move to your upper musculoskeletal assessment. So you can sit up straight for me if that's okay. All right, so what I want you to do is just kind of put your arms out there, and then I'm gonna push against your arms, just try to keep them up as straight as possible. All right, 5 out of 5 strength, that's good. Now I want you to kind of put your arms up like this, push against me. 5 out of 5 there. I'm gonna pull. 5 out of 5 there. All right. I know I am gonna check also your pulses while I am on your arms and stuff too here. Okay, radial pulse is good there. Radial pulse is good there. Radial pulse is good there. Brachial pulse is good there. Let's test your reflexes out. Both your arms here. So we're going to test your brachial reflexes. Okay. All right. Now I'm going to also look at your capillary refill. So this is just a circulation test, and that is capillary refill is +2, so that's good. Good, got good cap refill on both sides. Now I'm going to be doing a musculoskeletal exam on your lower legs or your lower body. So what I want you to do is push up on my arms. Goodness, perfect. 5 out of 5 strength there. And then now I am going to be testing your reflexes, your patellar reflexes here. Okay, good. Perfect. Okay, and then we're going to be testing some accommodation test, just testing some more reflexes too. So what I want you to do is I want you to touch your fingers to your nose and then to your knees. All right, now switch it up to your arm if that's okay. Okay, now we're gonna do what's called testing rapid hand and eye movements. So you're just kind of gonna flip-flop your hands on your knees back and forth, alternating. And you're gonna go slow at first, like that, that's perfect. And then you're gonna speed up, keep speeding up. Perfect, that's great. All right, now we are almost done with our assessment. So I'm gonna have you stand up now. And then basically right now, I just want you to remember a couple words, and then I'm gonna have you repeat these words in a couple minutes. So just remember apples, banana, and pear. Okay? All right, so we're gonna be doing what's called a Romberg test now. So I want you to close your eyes, and I want you to put your hands out like this. Sorry, I should have told you that first. No, perfect. Now stand on your left leg. And now put that down. Stand on your right leg. Perfect, you can open your eyes now. That was a pretty in-depth Romberg test, and you passed that, so that's good. Now we're going to be doing what's called tandem walking. This is just assessing your general gait. So tandem walking is basically walking heel to toe, heel to toe, heel to toe. So can you do that for me? Perfect, gait is normal. Now I just want you to hop on your left leg. Just do 2 hops. Hop on your right leg, 2 hops. All right, perfect. And now what were those words I asked you to remember?
Apple, banana, pear.
Perfect, okay. Well, you just did your head to toe assessment with flying colors. I am done with your physical exam. Everything came back normal. You're a good, healthy young man. And honestly, if you had anything adventitious that you had to ask me, you can ask now. Or if you had any, general concerns, do you have anything that you're worried about?
No, I think that was great.
Okay, all right. Well, that completes our exam. And again, please reach out if you have any other general concerns or questions.
Thank you for your help.
Thank you, Nick.